And we're live.
Hi, my name is Salter, and I'm here to do an assessment on you today. It's my understanding that you're here just for a checkup. Is that correct? Okay. I'm going to start by taking your vital signs. If you would please hold this under your tongue for me. Check your blood pressure. I'm going to be palpating for what's called an oscillatory gap. So you'll have to endure this being pumped up twice. I lost that pulse at 100, so we will pump that up to about 130 and check your blood pressure. And that blood pressure was 104/70. We would count that pulse for a full minute. The pulse was 60 and respirations were 60. Okay. Temp says 99.3. Okay. I'm going to be checking your skin and then kind of going from the top to the bottom. Okay. All right. Skin on the face is tan, light tan in color. There are multiple scattered freckles across the bridge of the nose and on the cheeks. I see no open lesions or any abnormalities. Skin on the upper extremities is warm. Hands and fingers are slightly cooler than arms, but arms have the same temperature bilaterally. Multiple pigmented macules, freckles on both arms bilaterally. On the superior of the left wrist is a small tattoo and a approximately 1 inch by 1/4 inch scar that is white in color. The lower extremities show no edema. Body hair distribution is even. Temperature of the lower extremities is equal bilaterally. Could you hold your hands out like that for me? Okay. The elasticity and hydration of the skin is good. Skin turgor appears to be normal. The nails are short, clean, well kept. There's no jagged edges on the cuticles. I see no ridges, no opacities. Capillary refill is less than 3 seconds bilaterally. If you could do like this with your fingers and hold those up for me, and do that with each finger.
All together or
One at a time, please. And then make these meet, then make these meet, then make these meet, and then the thumbs upright. Okay, no clubbing is noted with the shamrock technique. No spooning is noted, which could indicate an iron deficiency. The toenails are painted, and so the capillary refill on the tips of the toes appears to be good. Toenails are clean. There's no rips or tears on either foot bilaterally. I'm going to look at your hair. I'm going to be touching the top of your head and checking your hair right now, okay? Okay. Hair is clean. It is red in color, coarse, appears healthy and evenly distributed. I notice no open lesions on the scalp. No alopecia is noted. No infestation is noted. And I see no seborrhea. The scalp is freely movable with no crepitus noted. I'm going to be checking some things with your face. First, let's look at the head. The head is erect. There are no involuntary movements. It is midline. If you could, with your neck, if you will follow what I do, this will assess the range of motion with your neck. Touch your chin to your chest, okay? Turn your head from side to side for me, okay? Touch your each ear to the opposing shoulder without raising your shoulders as much as you can, okay? And then tilt your head back for me. Is any of that uncomfortable? Okay. So no problems with your neck, you've noticed, no range of motion issues there, okay? All right, I'm going to step behind you. The C7 vertebral prominence is palpable and easily discernible. The parietal, frontal, and occipital prominence are easily palpated on the skull. The intervertebral muscles appear firm with no tenderness. Is there any tenderness there?
No.
Okay. All right, if you would, I'm going to feel of your mandible, you know, what they call the TMJ.
Okay.
All right. If you would just open and close your mouth slowly for me. Okay. If you'll watch what I do, kind of jut your jaw forward, pull it back, and then wiggle it from side to side. Okay. There is no crepitus noted in the TMJ, no loud pops or clicks are noted. It is easily palpable and moves without difficulty. Did that cause you any discomfort? Okay. The nerves in your face can be tested, and I'm going to test some of those. Okay. If you will, this will test the fifth cranial nerve, the trigeminal nerve. If you will close your eyes and tell me if it feels sharp or soft when I touch, okay?
Sharp. Soft. Sharp.
Thank you. Okay. Now, if you would please, I'm going to test the facial cranial nerve, which is the seventh cranial nerve. If you would do what I do, if you will smile without showing your teeth. Okay, now smile showing your teeth. Now frown. Okay. Purse your lips for me. Puff your cheeks out. Stick your tongue into your cheek for me on either side. Okay. Now I'm going to, if you will close your eyes, all right, and raise your eyebrows with your eyes closed, okay? Now, you will look at me, kind of squint your eyes closed, and don't let me pull them open. Squint them closed and try not to let me pull them open, okay? All right. I'm also going to check your spinal accessory cranial nerve. If you will try to lift your shoulders against resistance, okay? And try to turn your head, we're gonna go this way first and then this way. All right, against the resistance, try to turn your head, okay? And now this way, all right. That nerve seems intact. We are going to be doing lots of vision things. When is the last time you had your vision assessed? Do you remember?
3 years ago?
Okay. Do you wear any corrective lenses in your eyes? Reading glasses?
I wear reading glasses.
Reading glasses, okay. You would use the Snellen chart to assess for distance vision. It is placed at a distance of 20 feet from the patient, and they read with one eye closed, then the other eye closed, and then both eyes open, the lowest level they can read. It is written as a fraction. Perfect vision is considered 20/20 for adults, and the smaller the fraction, the worse the vision. And then they do what is called a Rosenbaum test, which is close-up vision. I know if you wear reading glasses, you probably have problems with close-up vision sometimes. You hold the Rosenbaum card 14 inches from the face, and you read the lowest line you can read. Perfect is 14 out of 14. And then they base your binoculars, if you have to have those, on that. Okay? I'm going to be doing some different tests with your eyes. Okay? You would lean forward just a little bit for me. Okay, pupils are equal, they are round, they are symmetric, they are in the center of the eye. If you would, we're going to, we're going to do what's called confrontation. It tests your peripheral vision. If you would cover your left eye, okay? And what I'm gonna do is, this is the bunny,
Okay.
and I want you to tell me when you see the bunny,
Okay. I see the bunny.
okay?
See the bunny. See the bunny.
Okay, and now we're gonna do that with the other eye, okay? So again, here's our bunny,
See the bunny.
okay?
See the bunny. Bunny.
Okay, thank you. All right, now if you will follow my finger, we're gonna do the 6 cardinal gazes, which checks the oculomotor cranial nerve, the trochlear cranial nerve, and the abducens cranial nerve. If you will just look straight at my finger without moving your head and just follow my finger. Okay. We're going to check for accommodation with your eyes. What I want you to do is I want you to focus on the wall back there. And then when I tell you, I want you to bring your eyes and focus on this pin light, okay, on this light, okay? All right, now focus on the light for me, okay? The eyes converge symmetrically and the pupils constrict symmetrically upon convergence. Accommodation is good. Now, the fun part of shining a bright light in your eyes. Okay, if you will just look right here at my nose. Pupil constricts and is reactive to light, and there is consensual constriction. And we're going to do the other eye. And it is the same with that eye. Okay? All right. Now, if you would look just right back here for me. All right. The corneal light reflex is present. There is a twinkle in the eye that is at the same spot in both eyes. Okay. I'm going to test your corneal reflex. That is like a blinking reflex. Does it drastically bother you to have things touch your eye? I know you said you don't wear contacts.
I'll be brave.
You'll be brave. Okay. It's just a very small wisp of cotton.
Okay.
Teeny, teeny, tiny. Okay. Okay. Blinking's what we want. Look right here. There we go. That wasn't so bad, was it? Okay. We are going to assess the inner aspect of your eye. And then, well, actually, before we do that, I'm going to poke around on your eyes just a little bit. So if you would close your eyes, and I'm just going to feel and make sure that there's no exophthalmos noted, and there is not. The eyes are not sunken. The eyeball was still firm. There is no bulges or anything in the supraorbital fissures. Okay, if you would open your eyes. The palpable fissures are equal. There is no ptosis noted. Eyebrows are thin and but consistent with the hair on the head, as are the lashes. Lashes turn upward and downward and outward. I see no exudate or flaking in the lashes or the eyebrows. I guess we'll pick it. Okay. You just sit right here with me. Okay. The red reflex is noted. The sclera is white. The cornea is clear. The optic disc is approximately 1.5 millimeters in diameter. It is a creamy yellow. The macula densa is noted as a dark shadowy circle. I see no signs of hemorrhage or exudate. The fovea centralis is a white dot in the middle of the macula densa. All right, the arterioles and venules. The arterioles are brighter than the venules. They appear to be in a ratio of approximately 3 to 5. I see no mixing, no crossing. The retinal body is reddish purple in color. Okay. All right. And you would do the same to the other eye. Put my eyeballs back on. Okay. I'm going to be feeling a little bit more around on the head. Checking your temporal arteries. Okay. The pulse is noted. I'm going to listen to that. There is no bruit noted. I'm also going to inspect for your carotid arteries. You just hold your central. There is a mild pulsation noted bilaterally